The brain is arguably the most important organ in the human body. It controls every move we make. It's where we think, feel, react, and where all our most precious memories are stored. Imagine the one thing that creates your experiences, that control your moods completely turned against you, and things you identify as real, everyone else is telling you it's just a figment of your imagination. Imagine not being able to grasp that concept, that what you are positive is in front of you because you can touch it, see it, smell it, even taste it. No one else can. That is only some of the symptoms of having schizophrenia. I have lived with a sibling who was diagnosed with schizophrenia in his early 20s. Someone who was so young, vibrant, full of life. I had to experience the takeover of his brain, making him someone I barely recognized. I will share with you the common symptoms of schizophrenia, the stigmas that create a barrier between patients and non-patients, and some shared challenges in completing daily tasks due to schizophrenic episodes. First, I will identify what schizophrenia is and the most common symptoms associated with the illness. Schizophrenia is a brain disorder that affects 1% of the human population. Symptoms of schizophrenia include, but are not limited to, psychosis, delusions, hallucinations, and disorganized thinking and speech. In order to be diagnosed accurately with schizophrenia, these symptoms must persist for at least 6 months. Psychosis is disruptions to what a person thinks and sees, which makes it difficult for them to differentiate what is real and what is not. Despite any evidence of reality, a person with schizophrenia understands that what they have heard, seen, touched, tasted, or smelled is their reality, even though it is not there. Disorganized behaviors can range anywhere from mixing up speech during conversations to having difficulties in sustaining goal-like behavior, which may appear as childlike silliness or unpredictable agitations. An example of disorganized behavior could be a person dressing in clothing that is not weather permitted, like wearing shorts in the wintertime or a coat in the summer. Furthermore, I would like to talk about stigmas that create a barrier of understanding those with schizophrenia. According to the American Journal of Psychiatry, stigma is a form of social injustice that contributes to the onset of psychosis and schizophrenia. Self-stigma and public stigma are just a couple of many. The Internalized Stigma Mental Illness Inventory 29 defines self-stigma using 4 categories, including alienation, stereotype, endorsement, discrimination, experience, and social withdrawal. Due to the feeling of unworthiness, embarrassment, and taking stereotypes to self, such as people with mental illness are violent and can't live a normal life, causes you to feel ignored, not taken serious, and extremely discriminated against, which leads to social withdrawal. Self-stigma opens up room for self-sabotage. It can result in an increase in depression, reduce self-esteem, and create a barrier for recovery. Public stigma is defined as the negative or discriminatory attitudes that others have about mental illness. 38% of Americans refuse to live next door to a person with a mental illness, while 68% would not allow them to marry into their families. These stigmas create barriers between schizophrenic patients and their abilities to live amongst the norm. When delusions and hallucinations occur or progress, the patient may have problems with everyday tasks. Let's briefly talk about someone with without a mental illness. Being of sound body and mind, there is a level of difficulty to motivate yourself to get up, take care of your daily activities, convincing yourself to get to work, completing schoolwork, cleaning the house, playing with your children, and just having a healthy, sociable life. Then repeating that same cycle every day. Think about those difficulties and challenges and add a mental illness with developed psychosis to that. Simple tasks as Brushing your teeth in the morning can turn into refusing to brush your teeth because the government did something to your toothbrush. And if you start brushing your teeth, it will kill you and everyone around you. Seems extreme, right? But not to someone who is convinced that this is indeed the truth. Imagine seeing this image everywhere you go, following you, even attacking you, stabbing you in the face while you're trying to complete homework assignments. This is the reality of a diagnosed schizophrenic, Cecilia McGo. In the movie, A Beautiful Mind, a story about the American mathematician John Nash that suffers from schizophrenia, the audience see Nash living a life without knowing he has the disorder. So everything that's real to him becomes just as real to the audience. He is a well-established professor, gets married, has a son, and everything seems perfectly fine until there is a realization some of the world he created is not real. There is a point where he is giving his newborn son a bath, and he has a psychotic episode which he left his son unattended, where he almost drowned. To conclude, schizophrenia is a mental illness that affects a person's ability to think, feel, and behave clearly. Hopefully, gaining a little knowledge on the challenges schizophrenics face on a daily basis will open your healthy mind to see that your world is not the only world that exists. And instead of judging someone who doesn't have the mental capacity as you do, walk a mile in their shoes, or in this case, brain, and start to see the world just a little bit different.